Hello everyone, I'm Michael Phillip, your physical therapist who will be discussing ACL injuries in today's video. The incidence of an ACL injury is currently estimated at approximately 200,000 annually, with 100,000 ACL reconstruction surgeries performed each year. In general, the incidence of an ACL injury is higher in people who participate in high-risk sports such as basketball, football, skiing, and soccer. ACL stands for anterior cruciate ligament and is one of four main ligaments in your knee that provide stability to the knee. Your ACL attaches at the end of your femur bone located in the thigh and runs diagonally and inserts into your tibia, the long, hard shin bone of your lower leg. It prevents twisting the knee and limits the tibia bone from sliding forward too far. It is often injured during cutting, twisting, or landing awkwardly, and is more common in female athletes than males due to the differences in structure of the hips, knees, and the strength differences. Immediately after the injury, patients usually experience pain and swelling of the knee and it feels unstable. Within a few hours after a new ACL injury, patients often have a large amount of swelling, loss of range of motion, pain or tenderness along the joint line, and discomfort and pain with walking. After a suspected ACL tear, the doctor may order x-rays to make sure there are no associated fractures and or an MRI to confirm that there is a tear, first of all, and then to determine the extent of the tear. Most ACL tears will require surgery, especially if the patient expects to return to the sport or other rigorous physical activities. However, those with a sedentary lifestyle, those with a partial tear or partial tear that does not decrease the stability of the knee, may opt not to have the surgery. It has been shown in studies that your hamstring muscles can actually assist and take over the function of the ACL if it is torn. In this case, physical therapy will be needed to restore your range of motion and improve your strength and stability, eventually allowing you to return to your normal daily activities. However, for most, surgery is still the best option. Studies have also shown that living with an ACL tear can cause secondary injuries or increased arthritis later in life due to the chronic instability associated with not repairing it. There are several surgical options for repairing the ACL, which depends mostly on the patient and the doctor's preference, with positive and negatives for each option. The most common options are using other tendons in the body to replace your ACL. These can include your patella tendon or hamstring tendons. The other option is using a cadaver tendon. Prior to the surgery, you should discuss these options with your doctor, who will explain the pros and cons of each. Following your surgery, physical therapy will be crucial to your recovery. Typically, you will begin physical therapy within the first week following your surgery, and the progression will depend on the type of ACL replacement you had and the individual doctor's protocol. Initially, after surgery, the patient is usually able to walk with crutches and a brace. The crutches are commonly discontinued after about 2 to 3 weeks, and the brace within about 6 weeks following the operation, given the appropriate strength and stability has returned to the knee. Return to sport-type activities depends on the overall condition of the person, but is typically 6 to 8 months following the surgery. So there are the basics of an ACL injury and recovery. If you have further questions, I recommend consulting with your doctor or physical therapist. Till next time.